Hello everyone, I am Dr. Nagateja Bonala. I am an Interventional Radiologist at Clinic 7, Kukatpally, Hyderabad. Today, let's address an important question which I get asked very frequently. In short, yes. But let's understand. First of all, what is varicocele? It's when the veins in the scrotum around the testis become enlarged and twisted. That is varicocele. You can think of it like varicose veins in the legs, but here it happens around the testicles. So the testicles act like a factory that produces the sperm. For this factory to function well, it needs a proper environment, that is proper temperature, proper oxygen, clean blood flow, and normally the veins around the testicles carry the impure blood back to the heart through one-way valves as fast as they should. But in varicocele, when these valves become weak or when they fail completely, blood starts flowing backwards towards the testis. It sorts of leaks back, keeps pooling up in the dilated veins within the scrotum around the testicles, instead of draining out and flowing back to the heart. So because of this, two major problems occur. One is the heat buildup and second is the oxidative stress. Let's see what are those. Heat buildup. Normally, the testicles stay a little cooler compared to rest of the body, which is very vital for the sperm production. When blood pools in these enlarged veins, the temperature rises by a few degrees. Even this small rise in temperature can damage the entire balance of the sperm production environment. The second one is the oxidative stress. Because of the poor blood circulation, harmful molecules called free radicals build up. These create something called as oxidative stress, which not only weakens the sperm quality, but also damages their DNA at its core. This leads to DNA fragmentation, meaning the genetic material inside the sperm gets broken into pieces. So sperms with fragmented DNA may look normal under a microscope, and it leads to you getting a normal report on semen analysis. There is nothing wrong with that. Because it looks normal on a microscope, the report is given as normal. But when you go and check for your DFI, that is DNA fragmentation index, that's a separate report which is emphasized nowadays a lot. So when you see that DFI test, that may be abnormal, and those sperms which try to fertilize the egg will fail, and even if they succeed and even if you achieve pregnancy, sometimes they may cause early abortions, early miscarriages. So that's very dangerous. So overall, varicocele affects both the quantity and quality of the sperm in terms like fewer sperm, weaker sperm, and sperms with damaged DNA. This is how the fertility is affected, pushing you into infertility. Some men feel a dull ache or heaviness in the scrotum, especially after standing for long periods. And others may notice swollen veins, often described as a feeling like bag of worms. But in many cases, there are no obvious symptoms here. The only sign may be just the difficulty in achieving pregnancy or failed IUIs. In fact, studies show that nearly 40% of the men with infertility problems have a varicocele of some or the other grade. The good news is varicocele is treatable. Earlier, surgery was the only option, but today we can treat it with a modern, minimally invasive method called Varicocele Embolization, that too with much more advanced glue and foam technique. So through a tiny puncture in your thigh or sometimes even through the hand, we insert a thin tube guided to the abnormal veins in your testis and close all the abnormal veins using a special medical glue. So this removes that pooling factor as the body directs the blood to healthy normal veins, and it lowers the heat, eventually reduces the oxidative stress, and allows the sperm to develop in a healthier environment. The best part, with varicocele embolization, you would have no cuts, no stitches, no scars, no long hospital stays, no pain, and it's usually done under local anesthesia, and most patients can go home the same day and resume their works the second day. Now, one important point many patients ask me is, yes, and here's why. With surgery, because there is cutting and opening the area which is very sensitive, so there is always a small risk of injury to the testicular artery, nerve damage, or development of hydrocele due to the lymphatic injury. I'm not saying all this will happen always, but can happen. But with embolization, these complications simply do not occur because we never touch the artery, we don't disturb the surrounding nerves, or we don't even touch your lymphatic vessels. and all the work happens through the veins only, which are the problematic part, right? So that's why embolization is considered not just effective but also safer, and most importantly, semen quality and chances of natural conception improve after treatment, because the sperm DNA integrity improves once the environment becomes healthy again. So if you and your partner are facing infertility and a test reveals varicocele, don't lose hope. Safe, effective and scar-free treatments are available right here in Hyderabad. I am Dr. Nagateja Bonala at Clinic 7 at Kukatpally. If you have any questions regarding varicocele, feel free to ask in the comments below or reach out to us directly. And if you know someone who is going through a similar situation, share this video with them and subscribe to our channel to know more about varicocele and as well as many more non-surgical treatments for various other conditions like fibroids, thyroid nodules, varicose veins, etc. Stay healthy, stay positive. I am Dr. Nagateja. I will see you again.